Welcome to Suchak Medical. So in this video we will talk about each and every page main points from Harrison of Internal Medicine's book. So from the very beginning we will start from section 1 pain. So in this page the main point is the pain sensory systems. So it has mainly two division. One is peripheral mechanism, the other one is central mechanism. So in peripheral mechanism there are mainly three type of neuron: primary sensory afferent, motor neuron and sympathetic postganglionic neuron. As you know, the motor neuron and sympathetic postganglionic neuron, these two neuron has no function in pain sensation. So we will mainly talk about primary sensory afferent. So in the primary sensory afferent we can divide it three different type of neuron with respect to, you can see the main points are here, their diameter, degree and myelination. With respect to this point we can differentiate the primary sensory afferent neuron three type: A beta, A delta and C, and from them A beta function is to sense the normal touch, not painful touch, and this A delta and C, these two's function is to sense the painful touch. As you can see, most A delta and C fiber afferent responds to maximally only intense painful stimuli, but A delta, which is small diameter myelinated A delta, and this A delta's function is to sense the normal touch. Now what is sensitization? You can see the next point is sensitization. So in this paragraph, full paragraph, the author wants to say that sensitization is the mode activation of these two neuron, A delta and C, which are mainly sense the pain. So why is this happening? Because when intense, repeated and prolonged stimuli are applied to damage and inflamed tissue, the threshold of activating primary afferent nociceptor. What is nociceptor? These two, A delta and C, these two are called nociceptor because it carries the pain. So afferent nociceptor is lower, so the threshold of nociceptor becomes lower. So if this happen, if we apply normal touch, this normal touch will feel like pain because the threshold of activation of this nociceptor, means this pain receptor, are becomes low, the threshold. That's why it is called sensitization. So normal touch will feel like pain. And you can see the two terminologies are here. One is this one, allodynia, and the second one is hyperalgesia. So what is allodynia? This is as I said earlier, normal stimuli which will produce pain. Normally in ocular stimuli can produce pain. This is called allodynia. And what is hyperalgesia? This is any painful stimuli will sense more pain. This is called hyperalgesia. So now we will move to the next page. So what are the main points in this page? Non-receptor induced inflammation. In this, what will happen? You can see if any inflammation occurs, as we said earlier in sensitization, what happened? Due to inflammation, the prostaglandin, leukotriene, this causes more causes more sensation in this nociceptor. So what happened? If this bradykinin, prostaglandin, which are secreted by the tissues or other things, due to inflammation, it will cause a release of substance P from this nociceptor. This substance P will help to do more inflammation. This is called, here you can see, so the nerve ending secrete substance P which do more inflammation. This is called neuroeffector function. So this is the main point of this paragraph. So thank you. Please share and subscribe for more medical knowledge, and in next video we'll start from this.